Here's a sobering quote. Every family in Nebraska will be affected either by a death or serious illness. That's the message from one critical care doctor there as new coronavirus cases surge. In the last 24 hours alone, at least 1,300 new infections have been reported. The state positivity rate is above 17%. And at this very moment, hospitals are nearing capacity, with just 20% of the state's ICU beds still available. I want to bring in the doctor sounding that warning, Dr. Dan Johnson, Division Chief of Critical Care at the University of Nebraska Medical Center. Thank you for being with us, and obviously thank you for all you do, Dr. Johnson. Look, your state is in a world of hurt, the fifth worst outbreak in the country, and you wrote a really passionate post on Facebook, and I want to read part of it. It says, the doubling time for COVID-19 hospitalizations in Omaha is currently 21 days. We currently have 372 patients in the hospital. This doubling time means that in 3 weeks, there will be 744 COVID patients needing the hospital. In 6 weeks, there will be 1,488 COVID-19 patients needing the hospital. Bottom line, when you look at these kinds of numbers, doctor, is there any way that you could possibly handle them?
Well, if we get to that number of hospitalized patients, there's no possible way that the hospitals in Omaha could handle it. And that's partly why my colleagues and I tried to sound the alarm. A little bit over a month ago, we took to traditional media and to social media to try to make sure that people in Nebraska understand the gravity of the situation.
So talk about your message, because obviously the numbers just keep going up, and it's not just Nebraska, it's in states all around the country. What is it that you think people aren't getting?
I think that people have grown tired of COVID-19 and they've let their guard down. And honestly, the number one message right now is people need to avoid being indoors with people who aren't in their own household. There's this sort of false concept of being in a bubble where multiple families can be getting together indoors, having parties, having dinners. That time has passed. We need everyone to stay home with their own household and not be gathering in any capacity.
Yeah, this I only see my best friends kind of thing that maybe we saw in the summer when people were outdoors can't be the case when people have to be indoors in places like New York and Nebraska where it's cold. You know, back in the spring, doctor, when New York, where I live, was the epicenter of the crisis, we saw doctors and nurses from all around the country literally flocking to New York to lend a hand. But how worried are you that your state could run out of space and medical staff, and because the virus is spreading so much everywhere in the country, that extra help just wouldn't be there for you?
I'm extremely worried about that. And there are no healthcare workers in other parts of the country to come help us, because every part of the country is now surging and spiking, unlike in the spring when New York was really hit so hard. And what people need to realize is, if we run out of beds, if we run out of nurses, respiratory therapists, it's not just for COVID-19. It's for heart attacks, it's for strokes, it's for car accidents. So imagine one of your family members needs medical care and can't get into a hospital because we filled all the beds with COVID-19 patients. That's a really bad situation.
It's a devastating situation, and obviously it's one that you and your colleagues are increasingly dealing with day after day after day, difficult decisions, difficult conversations that have to be had by telephone with family members. How are you doing? How are your colleagues doing?
Right now, we're holding up okay. What we're mostly worried about is a scenario where we wouldn't be able to deliver medical care because we don't have the facilities or the staff. So mentally, physically, I feel that Omaha healthcare workers are holding up. It's most difficult for nurses and respiratory therapists. I want to emphasize that the physicians have it easier than the nurses and the respiratory therapists. But, you know, we could get to a scenario where we have people outside of our emergency departments and we are not able to get them in. That is what we are most worried about.
You know, I was talking to Dr. Ashish Shah at the top of the show, and we were talking about this period between. There's this great news about Moderna. There was previously last week great news about Pfizer. The efficacy rates, early trials of their vaccines are much higher than I think a lot of people expected. As somebody who is very much on the front lines of this crisis, how encouraged are you by this news, but how worried are you about this period between now and when we actually see widespread vaccinations?
Well, anytime we have a vaccine that is well studied, appropriately tested, and it comes out that the vaccine works, that's excellent news. Of course, vaccines only work if people take them. So I want to kind of comment on, I hear people saying that they won't take a vaccine even if it's approved. If a vaccine makes it through the rigorous FDA approval process and the FDA says that it's safe and that it works, people need to take it. If they want to put COVID-19 in the rearview mirror anytime soon, a vaccine is going to be a critical component of that. But again, that's months away. So we need people to take action right now and stop gathering. We need masks to be worn and we need people to stop gathering.
We can't say that enough. And Dr. Dan Johnson, thanks to you, thanks to your colleagues. We really appreciate you taking the time to speak with us, and we wish you all the best as you head into what I know is another difficult time where you are and all around the country.